The COVID-19 pandemic is one of the most manipulated infectious disease events in history, characterized by official lies in an unending stream led by government bureaucracies, medical associations, medical boards, the media, and international agencies. We have witnessed a long list of unprecedented intrusions into medical practice, including attacks on medical experts, destruction of medical careers among doctors refusing to participate in killing their patients, and a massive regimentation of healthcare led by non-qualified individuals with enormous wealth, power, and influence. For the first time in American history, a president, governors, mayors, hospital administrators, and federal bureaucrats are determining medical treatments based not on accurate, scientifically based, or even experience-based information, but rather to force the acceptance of special forms of care and prevention, including remdesivir, use of respirators, and ultimately a series of essentially untested messenger RNA vaccines. For the first time in history, medical treatment protocols are not being formulated based on the experience of the physicians treating the largest number of patients successfully, but rather individuals and bureaucracies that have never treated a single patient, including Anthony Fauci, Bill Gates, EcoHealth Alliance, the CDC, WHO, state public health officers, and hospital administrators. The media, TV, newspapers, magazines, etc. Medical societies, state medical boards, and the owners of social media have appointed themselves to be the sole source of information concerning this so-called pandemic. Websites have been removed, highly credentialed and experienced clinical doctors and scientific experts in the field of infectious diseases have been demonized, careers have been destroyed, and all dissenting information has been labeled misinformation and dangerous lies, even when sourced from top experts in the fields of virology, infectious diseases, pulmonary critical care, and epidemiology. These blackouts of truth occur even when this information is backed by extensive scientific citations from some of the most qualified medical specialists in the world. Michael Yeadon, a retired ex-chief scientist and vice president for the science division of Pfizer Pharmaceutical Company in the UK, who charged the company with making an extremely dangerous vaccine, is ignored and demonized. Further, he, along with other highly qualified scientists, have stated that no one should take this vaccine. Dr. Peter McCullough, one of the most cited experts in his field, who has successfully treated over 2,000 COVID patients by using a protocol of early treatment, which the so-called experts completely ignored, has been the victim of a particularly vicious assault by those benefiting financially from the vaccines. Neither Anthony Fauci, the CDC, WHO, nor any medical governmental establishment has ever offered any early treatment other than Tylenol, hydration, and call an ambulance once you have difficulty breathing. This is unprecedented in the entire history of medical care, as early treatment of infections is critical to saving lives and preventing severe complications. A good example of this outrage against freedom of speech and providing informed consent information is the recent suspension by the medical board in Maine of Dr. Meryl Nass's medical license and the ordering of her to undergo a psychiatric evaluation for prescribing ivermectin and sharing her expertise in this field. Other unprecedented attacks. Another unprecedented tactic is to remove dissenting doctors from their positions as journal editors, reviewers, and retracting their scientific papers from journals, even after these papers have been in print. Worse still is the actual designing of medical articles for promoting drugs and pharmaceutical products that involve fake studies, so-called ghost-written articles. Richard Horton is quoted by The Guardian as saying, "Journals have devolved into information laundering operations for the pharmaceutical industry." As concerns the information made available to the public, virtually all the media is under the control of these pharmaceutical giants or others who are benefiting from this pandemic. Their stories are all the same, both in content and even wording. Orchestrated cover-ups occur daily, And massive data exposing the lies being generated by these information controllers are hidden from the public. While these attacks on free speech are terrifying enough, even worse is the virtually universal control hospital administrators have exercised over the details of medical care in hospitals. These hirelings are now instructing doctors which treatment protocols they will adhere to and which treatments they will not use, no matter how harmful the approved treatments are or how beneficial the unapproved treatments are. The Federal Care Act encouraged this human disaster by offering all U.S. hospitals up to $39,000 for each ICU patient they put on respirators, despite the fact that early on it was obvious that the respirators were a major cause of death among these unsuspecting, trusting patients. In addition, the hospitals received $12,000 for each patient that was admitted to the ICU, explaining, in my opinion and others, why all federal medical bureaucracies, CDC, FDA, NIAID, NIH, etc., did all in their power to prevent life-saving early treatments. For example, Mayo Clinic fired 700 employees for exercising their right to refuse a dangerous, essentially untested experimental vaccine. Mayo Clinic did this despite the fact that many of these employees worked during the worst of the epidemic and are being fired when the Omicron variant is the dominant strain of the virus, has the pathogenicity of a common cold for most, and the vaccines are ineffective in preventing the infection. When this pandemic started, hospitals were ordered by the CDC to follow a treatment protocol that resulted in the deaths of hundreds of thousands of patients, most of whom would have recovered had proper treatments been allowed. The majority of these deaths could have been prevented had doctors been allowed to use early treatment with such products as ivermectin, hydroxychloroquine, and a number of other safe drugs and natural compounds. One must also keep in mind that this event never satisfied the criteria for a pandemic. The draconian measures established to contain this contrived pandemic have never been shown to be successful, such as masking the public, lockdowns, and social distancing. It was also known that children were at essentially no risk of either getting sick from the virus or transmitting it. Tools of the indoctrination trade. The designers of this pandemic anticipated a pushback by the public and that major embarrassing questions would be asked. With each confrontation with carefully documented evidence, the media fact-checkers countered with the charge of misinformation and an unfounded conspiracy theory charge that was, in their lexicon, debunked. Never were we told who the fact-checkers were or the source of their debunking information. We were just to believe the fact-checkers. A recent court case established under oath that Facebook fact-checkers use their own staff opinion and not real experts to check facts. When sources are in fact revealed, they are invariably the corrupt CDC, WHO, or Anthony Fauci, or just their opinion. Here's a list of things that were labeled as myths and misinformation that were later proven to be true. Another tactic by the vaccine proponents is to demonize those who reject being vaccinated for a variety of reasons. The media refers to these critically thinking individuals as anti-vaxxers, vaccine deniers, vaccine resistors, murderers, enemies of the greater good, and as being the ones prolonging the pandemic. This level of cruelty is terrifying and signifies the collapse of a moral, decent, and compassionate society. Logic, reasoning, and scientific evidence has disappeared in this event. Has scientific evidence, carefully done studies, clinical experience, and medical logic had any effect on stopping these ineffective and dangerous vaccines? The war against effective, cheap, and very safe repurposed drugs and natural compounds that have proven beyond all doubt to have saved millions of lives all over the world, has not only continued but has stepped up in intensity.